Hello, it is time for another anatomy lesson, and we are on to another unit. This unit is the muscular system, and this video is going to cover an introduction to the muscular system. So that means we're going to overview the 5 main topics that we're going to cover, but detail will be covered when we do those topics individually as we progress through the unit. So this is meant to be an overview to the unit. So let's get started. The first topic we're going to cover is introduction and functions. So 30 to 40% of our body mass is muscles, and we have over 650 muscles. The muscular system has a whole assortment of functions. The one you might think of first is movement, but it also generates body heat. So think about it. You shiver to generate some body heat, but also when you're working out or exercising, you start to feel warm, and it's because our skeletal muscles do in fact generate body heat. The muscular system also guards our entrances and exits and serves some protection and body shape. There are 3 main types of muscles: smooth, cardiac, and skeletal, and there are 5 rules for skeletal muscle activity. So skeletal muscles, nearly all of them, cross at least one joint. They have at least 2 attachment points called the origin and the insertion. Most of the muscle lies proximal to the joint that's crossed, and muscles only pull, they never push. So when you're doing a push-up, you have no muscles pushing, you have other muscles pulling. And the insertion always moves toward the origin. And again, this is just meant to be an overview. We'll discuss this in more detail when we get to that topic. So what is one of the rules for skeletal muscle activity? I just talked about them. Do you remember? Okay, here they are. It crosses at a joint, nearly all of them cross at least one joint, 2 or more attachment points called the origin and insertion. Most of the muscle lies proximal to the joint that is crossed. Muscles only pull, they never push, and the insertion always moves toward the origin. Muscle names. Muscles can be named by a whole wide range of things, including their shape, like the trapezius and the deltoid, the number of origins, biceps and triceps. Their specific attachment points, like the sternocleidomastoid in your neck. Their location, the frontalis or the biceps femoris, indicating your leg. Their size, the gluteus maximus, because there's gluteus medius, gluteus minimus, your pectoralis major muscle. Also the direction of the fibers, the rectus, straight, abdominis, and their function, flexor carpi, that's using to flex the wrist. Okay, and here are the muscles that we are going to focus on in this unit, okay? There are a few that I want to focus on today. Frontalis, mentalis in your chin, pectoralis major. This one, which I'm hiding, so let me just move this for a moment. You can see the sartorius. That's actually the longest muscle in your body, and it wraps, you could see from your hip area around toward your knee, okay? That's the sartorius, okay? The sternocleidomastoid, which I just talked about. Let's see, then the gastrocnemius, your calf muscle, the gluteus maximus, which we talked about already. Okay, so again, these are the muscles that we are going to focus on, not learning all 650. There are 206 bones, but over 650 muscles, tendons. So what you look at in this picture as the white represents the tendons, and they're going to attach your muscles to your bones, which is what is going to allow them to help with movement. And your quadriceps are 4 muscles, and you do not need to learn the names of those, but I did include them here. And the hamstrings, and they are a group of 3 muscles, okay? So give one way that muscles are named. So do you remember? Muscles could be named accordingly. There was a big list of things. So what's one thing that we could use to name muscles? Do you remember? Size, shape, their attachments, the origin, their function or action, their location, the direction of the fibers. All right, muscles in children is in topic 3. So muscles develop superior to inferior. So babies can lift their head before they can walk. Otherwise, that would look a little weird, right? and proximal to distal. So babies can move their arms around before they can finally grasp objects. So because of that, infant development progresses in a typical order. They can lift their head, roll over, sit up, crawl, and walk. And there are many ways to encourage muscular development in children. So getting dressed, tying shoes, being active. Obviously, getting dressed and tying shoes is not appropriate for an infant, but being active, self-feeding, tummy time. Tummy time begins basically at birth, playing, self-feeding, art skills. All of those things are important to develop both gross motor and fine motor skills. And that's what we'll talk about in great detail in this topic, gross motor versus fine motor. But one thing that I have personal kind of stand against is W sitting. W sitting is that traditional, like up here, you can see this child sitting with the legs splayed out like this, and it looks like from above a W. The risks of W sitting include dislocation of joints, lack of muscle strength, and lack of cross-body movements. Some alternatives include sitting crisscross, so crisscross applesauce, side sitting, on your knees, even on a chair or stool. Okay, it's important to avoid W sitting. So what are some things that you can do to support muscular development in children? Well, there's a whole big list of them. Do you remember one? Or more than one? Here are the things: no W sitting, tummy time, getting dressed, self-feeding, being active in sports, art skills, a whole bunch of things, even just playing, okay? Now, the next topic is using muscles. So isometric means the muscles are in the same length. So when you're doing planks, holding a position, okay? Plyometric is when the muscles are changing length. So you might be jumping or running, big movements, okay? So again, those are comparing two ways that muscles being used are compared. And then another way is comparing isometric, isotonic, and isokinetic. So isometric is still the same length, like when you're doing a plank. Isotonic is the same tension, so like the same amount of weight, but there is movement, okay? So think about when you're doing a bench press. You're not changing the weight in the middle of the bench press, but as you are pushing up, you have certain muscles that are lengthening and others that are shortening. And then when you lower it back down, the same thing, but the opposite muscles will be lengthening and shortening. So when you do isotonic, eccentric, the muscle lengthens, concentric, the muscle shortens. And an isokinetic means the same speed, but we need a special machine for that, so that's not something that we really have to consider or think about, okay? Importance to this is muscle fatigue. Muscle fatigue means the decline in muscle force over time. So you might have been able to do 20 sit-ups the first time, and then you could only do 15, or then the next time you might only be able to do 8, okay? And some contributing factors, a primary one is lactic acid buildup, as our muscles do not have enough oxygen to properly break down glucose for energy. We might not have enough vitamins or ions like vitamin D or calcium. There might be impaired blood flow. It happens with age. And it also happens with certain health conditions like cancer, obesity, and stroke, just to name a few. So what are some treatments and prevention for muscle fatigue? So stretching, super important, and rest. So proper training. Some things that can help to prevent muscle fatigue include caffeine, garlic, ginseng, and multivitamins, especially ones that include vitamin D. Okay, so how are isometric and isotonic different? Do you remember? Well, isometric means the same length, so there's no movement like a bench press or planks. Well, a bench press, if you are just holding it, right? Holding it. Isotonic, the same tension, there's movement, but the same weight, like arm curls. And we have eccentric when there's lengthening of the muscle, and concentric when there's shortening of the muscle. Oops. Okay, our last topic is origin, insertion, and movement. So the origin is the immovable muscle attachment point on a bone, okay? And the insertion is the movable attachment point. So flexion as a movement is bending of a joint, so decreasing the angle. So here's my finger, flexion, flexion, flexion. Extension is straightening of a joint, increasing the angle. So there's my finger, extension, flexion, extension, flexion, extension, flexion, extension. And then we have abduction, making a big angle. Abduction, adduction, small angle. Abduction, adduction, abduction, adduction. And we can use other body parts for that as well. And then the last one I'm going to talk about here, pronation and supination. This is pronation, supination. Pronation, supination. Ask for soup. Soup, please. Pronation, supination. Soup, please. Pronation, supination. Soup, please. Also for abduction, one of my nurse friends did tell me that abduction, think about, remember, it's making a big angle, so your arms would be up here, thinking about getting ready to abduct someone. Which position? Okay, big angles, abduction. All right, so what is the difference between abduction and adduction? That little hint, do you remember? Big angle, like to abduct someone, okay? And adduction, making a small angle, the opposite of abduction. That's it. Okay, if you have any questions, leave a comment, like and subscribe, and there will be more videos coming.